Assalamu alaikum. Bismillahirrahmanirrahim. You always pass failure on the way to success. My topic of presentation is herpes simplex. In this presentation, I am going to introduce you to the introduction of herpes simplex, its epidemiological triad, chain of transmission, levels of prevention, and recent advances. Learning outcome. At the end of the presentation, you will be able to describe the epidemiological triad, prevention aspects, and recent advances of herpes simplex. Introduction. Herpes is an infection caused by herpes simplex virus. It is further subtyped into two types. Herpes simplex virus type 1, which is also known as human herpes virus type 1, and herpes simplex virus type 2, also known as human herpes virus type 2. Discussing the global prevalence. An estimated 3.7 billion people under the age of 50, which is 67%, have herpes simplex virus 1 infection globally, and an estimated 491 million people aged 15 to 49, which is 13% worldwide, have herpes simplex virus 2 infection. This is an area map showing the global prevalence of herpes simplex virus infection. In the top, the area map is showing the prevalence of females. The highest prevalence is in Africa and region of Americas. And in the lower area map, it's showing the prevalence of males. And again, the highest prevalence is in the region of Africa and the region of Americas. Herpes virus. Herpes virus family is further divided into alpha herpes virus, beta herpes virus, and gamma herpes virus. The basis of this division is that where the virus is going to rest in the latent stage. If it is resting in ganglion, or it can rest in salivary glands or the lymphoid tissue. In herpes simplex virus 1, 2, and varicella zoster infection, the herpes virus rests in ganglion, so that is a alpha herpes virus. In beta herpes virus, in latent stage, the virus rests in the salivary glands. Examples are human herpes virus 5, also cytomegalovirus, human herpes virus 6, and human herpes virus 7. The last class is the gamma herpes virus, in which the virus in latent stage rests in the lymphoid tissue. Example is the Epstein-Barr virus, also known as human herpes virus 4. In this presentation, we are going to cover human herpes virus 1 and human herpes virus 2. And in latent stage, this virus rests in the ganglions. Coming to the epidemiological triad, which includes agent, host, and the environment. Agent. We have already discussed that it is a type of herpes virus, and in its latent stage, it rests in the ganglion. And it is a double-stranded DNA virus with an envelope. And human herpes virus 1 causes oral herpes mostly, and human herpes virus 2 causes genital herpes mostly. uh, Comparing the both of these viruses, human simplex herpes simplex virus 1 causes lesions above the waist mostly, but it can also cause lesions below the waist. And herpes simplex virus 2 causes mostly lesions below the waist, but it can also cause lesions above the waist. The most and latency of human herpes simplex virus 2 is the sacral ganglia. This is a picture showing that when the virus attaches, enters the epithelial cell, uh, uh, there is lysis and replication of virus, from which it spreads to the other epithelial cells, and from there it enters the nerves and rests in the ganglion and stays there for life. From time to time, depending upon the person, the virus again goes via retrograde axonal spread and affects the epithelial cells. But the second and third time, the severity of the disease is decreased. Coming to the host factors, ages. All ages are susceptible, and both males and females are susceptible. The factors which cause reactivation of disease are stress, sunlight, and infections. Iceberg phenomena is seen with this disease as symptomatic cases are very few and there is large number of asymptomatic infections, and these asymptomatic cases also cause spread of this virus. Incubation period is 2 to 5 days after attachment of virus to epithelial cells. Discussing about the communicability. Herpes virus is most contagious when symptoms are present, but can still be transmitted to other in the absence of symptoms, that is the asymptomatic carriers. Modes of transmission are skin to skin contact, sexual contact, and mother to child transmission. Coming to the levels of prevention, which include primary, secondary, and the tertiary level. Primary level includes health promotion and the specific protection. In health promotion, we can educate the community about the problem, disease, its prevention and treatment. People with active symptoms of oral herpes should avoid oral contact, and sharing objects should be avoided that have contact with saliva. Individuals with symptoms of genital herpes should abstain from sexual activity, and use of condoms can prevent the spread of genital herpes. Coming to the specific protection, currently there is no licensed vaccine for herpes simplex virus. Secondary prevention includes early diagnosis and prompt treatment. Diagnosis is usually clinical, but PCR can be used to detect DNA, virus isolation can be done, antibody detection can be done, and Zank smear can be used, which takes the cells from the base of the ulcer, from the lesion, and multinucleated giant cells are seen in case of herpes simplex virus. Clinical features. Symptoms of herpes include painful fluid-filled blisters or ulcers at the site of infection, more commonly around the mouth and the genital areas, but they can be anywhere in the body and can also be at pharynx and nasopharynx. Talking about the neonatal herpes. Neonatal herpes occurs when the infant is exposed to herpes simplex virus in the genital tract during delivery. It is a rare outcome occurring in 10 out of every 100,000 births globally. The risk of neonatal herpes is greatest when the mother acquires herpes simplex virus infection for the first time in the late pregnancy, because first time the infection is very severe, and after the frequent reactivation the severity of the infection decreases. And to treat neonatal herpes, if there is clinical rash, we can treat it with antivirals such as acyclovir. Coming to the herpetic whitlow. Herpetic whitlow occurs when the herpes simplex virus involves the fingers of the hand. This is important from public health point of view because they can spread this virus to others as at an exponential rate, and this is most commonly seen in the healthcare workers. Treatment. Mostly no medications are required, but antiviral medications such as acyclovir, famciclovir, and valacyclovir can be used to reduce the severity and frequency of symptoms, but cannot cure the infection. Tertiary prevention includes disability limitation and early rehabilitation. In immunocompromised people have more severe symptoms and more frequent recurrences. And the complications of this disease include encephalitis, which is the brain infection, and keratitis, which is the corneal infection. In herpetic keratitis, there is a typical dendritic ulcer seen in the cornea, and we can treat it with topical antiviral ointments. Encephalitis is also a rare complication which shows decrease in the level of consciousness and altered mental state presenting as confusion. The electrical activity of brain changes as the disease progress. First, it involves the temporal lobe, then it involves the other temporal lobe, and there is change in the electrical activities. CT scan and MRI also show change at the temporal lobe of the brain. And the mortality due to encephalitis is high if it develops. Coming to the updates. Massive proportion of world's population are living with herpes infection. In 2020, WHO has reported about half a billion of people worldwide are living with genital herpes, and several billion people have oral herpes infection. Now, WHO responds to herpes, as well as increasing awareness about herpes simplex virus infection and its symptoms, improved access to antiviral medications, and heightened HIV prevention efforts for those who have genital herpes infection symptoms are needed globally. In addition, better development of treatment and prevention is needed, particularly herpes simplex virus vaccines. WHO and its partners are working to accelerate research to develop new strategies for prevention and control of genital and neonatal herpes infections. Genital herpes is included in a sexually transmitted infection. Global Health Sector Strategy on Sexually Transmitted Infection 2016 to 2021 aims to end STIs as a public health problem by 2021, and genital herpes has been included in this. Um, the present Global Health Sector Strategy on Sexually Transmitted Infection 2016 to 21 builds on conclusions from the evaluation of the implementation of the global strategy for the prevention and control of STIs, and sets out vision, goals, targets, and guiding principles and priority actions for ending the STIs epidemic as a public health problem by 2021. WHO guidelines for treatment of genital herpes simplex virus. STIs are major public health problem worldwide, affecting quality of life and causing serious morbidity and mortality. STIs have direct impact on reproductive and child health through infertility, cancers, pregnancy complications, and they have indirect impact in role of facilitating sexual transmission of HIV, and thus have also impact on national and individual economies. More than a million STIs are acquired every day. To deal with the STIs, WHO has proposed a universal healthcare model in which the current coverage, it aims to increase the current coverage by increasing the population who is covered, increasing the services which are covered, and increasing the direct cost and proportions of cost covered, like it aims to increase the insurance system and pro-poor protection initiatives. Talking about the sustainable development goals, goal 3 has a target by 2030 ensure universal access to sexual and reproductive health services, including for family planning, information and education, and integration of reproductive health into national strategies and programs. Discussing the relation of STIs such as herpes simplex virus type 2 and syphilis can increase the acquisition of HIV infection. There is 3-4 or more risk of a person with herpes simplex virus type 2 and syphilis to get HIV infection, and those having HIV, when they get STI, herpes simplex virus, there are frequent recurrences and increased severity of the disease. Now it's time for the MCQs. Besides genital, besides genital and mouth, where else can herpes simplex virus occasionally appear? All areas of bodies are susceptible. It can appear anywhere in the body. Early symptoms of herpes simplex include which one of the following? A.
Itching and burning with sensation where lesion is to be
Yes,
appeared.
the correct answer is B. Itching or burning sensation where the lesion is about to appear. When herpes simplex virus is not active, what happens to it?
Inside the nerve cells.
Yes, as this is an alpha virus, it lies dormant inside the nerve cells. How often does an outbreak of lesion occur? Yes, the correct answer is D. It varies from person to person. It depends upon the immunocompromised state or the stress factor, sunlight exposure, and the infections. Aim of universal health coverage in STDs is to increase out-of-pocket payment for treatment of STDs, to increase the proportion of population covered for treatment of STDs, to decrease the financial insurance for treatment of STDs, or to decrease the services provided. Yes, the correct answer is B. Universal healthcare model. It aims to increase the population covered. What is the main genetic characteristic of herpes virus? The correct answer is double-stranded DNA with envelope. Herpes virus is not associated with which disease? Infantile paralysis, encephalitis, STIs, or cervical cancer? The correct answer is infantile paralysis. This is also known as poliomyelitis. Cervical cancer, although the main cause is human papilloma virus, but some associations have been shown with the herpes simplex virus type 2. Global health strategy towards ending STIs aim to end STDs as public health problem by, the correct answer is 2021. From the public health perspective, which one of the following infection of herpes is most important? Yes, herpetic whitlow is the most important because it causes more transmission. Iceberg phenomena of disease is seen with D. Yes, correct answer is herpes simplex infection. These are the references of my presentation, and thanks.
Thank you very much, Dr. Mehri. Again, you have worked very hard, and your presentation was very comprehensive, and it has covered all the important aspects. There are all important things like prognosis, how we have to do with the transmission of other diseases, including HIV, syphilis, and what should be the diagnostic tests. Everything has been covered very well. However, there are only few comments that are present that for preventive point of view, we know that the antiviral therapy, it has a major role in reducing the subclinical shedding of herpes simplex virus. As we know that the herpes simplex virus is a DNA virus, so the molecular diagnostic techniques that are very important, and the serotyping, again, it is having one of the very important role in prevention. Why? Because it has three important implications. First, for the prognosis. We know that herpes simplex virus 1, its prognosis is much better than herpes simplex virus 2. So from prognostic point of view, serotyping is important. Second, for counseling purposes, as we know that the herpes simplex virus 2, it is the virus that is associated with more recurrences, and the severity of the disease and the frequency of the disease increased with herpes simplex virus 2 rather than with herpes simplex virus 1. So the serotyping is very important for the prognostic point of view. Second important thing is about counseling. We know that the counseling for the patient, especially for genital herpes simplex virus 2, that needs more counseling, and it is one of the virus that can cause the transmission from the asymptomatic mother to the neonatal infection. And this neonatal infection that has been transferred by the asymptomatic mother can lead to very serious complications, including encephalitis and many other complications. So we have to counsel the patients about the type of the virus that is associated with it. Number third is about the transmission of other sexually transmitted diseases. We know again that the herpes simplex virus type 2, it increases the transmission of HIV, and that increased is more than 3 to 4 fold rather than without having herpes simplex virus infection. So we have all these important aspects why we need testing for different serotypes. My question from the class is, what is the specimen of choice in the case of herpes simplex virus? What is the specimen of choice?
Scrapping from the lesion, probably.
Very nice. Within first 3 days of vesicular lesion appearance, if the specimen is obtained, that is the specimen of choice. So we should be very clear about the specimen of choice in herpes simplex virus. It should be from the vesicular lesions. And the fluid in the vesicular lesion, as we know, after 3 days, it circulates and started crusting. So it should be within the first 3 days. Another important point that I want to stress here is that the use of alcohol swabs, or where we use pyodine in our settings, on all those things that contain alcohol or pyodine or some derivatives of these compounds, they should not be used to clean the lesion, because once the lesions are cleans with these swabs or with pyodine, it causes the inactivation of the virus. So the lesion would not lead to the correct diagnostic fluid that is needed for the specimen. All these lesions should not be clean with any of these agents, so that the proper sample can be taken. And this is the specimen of choice, that is from the vesicles. And the next is, what is the test of choice?
PCR.
Very nice, Dr. Sadia. Very correct answer. As Dr. Mehreen has said about Zank smear, and about we also have the serology that is available for herpes simplex virus. But as we need a highly sensitive and highly specific test, so it is the PCR for the DNA of herpes simplex virus. Another important gold standard is the viral cultures. However, the viral cultures are not widely available. So the standard viral cultures, where they are not available, it is again something that should be in the policy, because in 2021, if we want to have the elimination of this disease, we need more diagnostic tests for better surveillance. So at the moment in Pakistan, the gold standard would be the PCR for viral DNA. If you have any question, you are most welcome to ask, please. Okay, thank you very much. Allah Hafiz.